Baking soda, or sodium bicarbonate, that fine white powder so familiar that you might think it's only good for deodorizing or softening dough, actually acts as a pH regulator in the body, and its effects on physiology, especially blood circulation and sexual function, are far more complex than its humble appearance suggests. Once we pass the age of 65, our endogenous bicarbonate buffering mechanism gradually declines, leading to a tendency toward excess acidity in the body. This triggers an undesirable cascade of reactions. Blood vessels constrict, the immune system comes under stress, and the production of nitric oxide, the key molecule for vasodilation, is suppressed. That is why many people at this age feel sluggish. Their limbs grow cold more quickly, their minds fog over, and interpersonal needs, particularly libido and erectile capacity, diminish noticeably. When you take an appropriate dose of baking soda, typically 1/4 teaspoon dissolved in a glass of warm water, you are directly supplementing your bicarbonate buffer system, neutralizing excess acids, and restoring your blood pH to the ideal level of around 7.4. In a balanced pH environment, the enzyme nitric oxide synthase functions more efficiently, promoting nitric oxide synthesis, relaxing smooth muscle in the vessel walls, improving elasticity, and reducing pressure differentials along arterial segments, meaning blood flows faster, reaching muscle tissues and the corpora cavernosa in the penis or the spongiosum in the vagina more readily. The positive outcome extends beyond enhanced sexual desire to improved erectile maintenance, heightened sensitivity, and prolonged intercourse, fostering greater confidence and closeness in marital relationships. At the same time, better circulation also enhances oxygen and nutrient delivery to all cells, smoothing muscle and brain function, reducing fatigue, and elevating overall mood, crucial factors for sustaining long-term sexual health. In my personal experience of over 25 years treating elderly patients, I have found that using baking soda scientifically, without overuse, spaced evenly 3 to 4 times per week, and combined with gentle exercise such as walking or yoga, can yield results that sometimes exceed patients' expectations. I have witnessed many seniors who, after a few weeks of use, not only feel their lost energy rekindled, but also confess that baking soda makes me feel more attractive in my partner's eyes. My stance is clear. Baking soda is not a universal miracle cure, but it is the essential minimal factor needed to jumpstart physiological systems that have become inefficient over time. When this habit is paired with a diet rich in greens, limited processed foods, and an active lifestyle, you are building a solid foundation for long-lasting health. If you find this information helpful, please subscribe to the channel and hit the notification bell so you won't miss future videos from me, Dr. Harris. Don't hesitate to leave a comment below. I read every message and promise to answer each question personally. Let's reignite our vitality together and connect more fully with our loved ones. Let's begin with why poor blood circulation makes us feel alienated from ourselves. When blood flow slows, you not only lose the sensation of vigor and dynamism, but also gradually lose yourself in every moment of life. Production of nitric oxide, NO, the most important natural molecule that helps dilate the vessel walls, declines with age and pH imbalance, causing the enzyme nitric oxide synthase to no longer have the fuel to operate smoothly. The result is constricted blood vessels and increased intravascular pressure. Even the smallest movements, such as stepping out of bed, can become a challenge. You may notice your hands and feet suddenly feeling cold, as if they've forgotten how to retain heat. Meanwhile, your brain suffers from cognitive fog, leaving each day with only a vague memory of the energy and clarity that once defined you. Your heartbeat is no longer strong, growing sluggish and incapable of delivering the oxygen and nutrients each cell needs. And each of those cells is a building block of life, joy, and the connections you share with loved ones. Many of my patients have exclaimed, "Lately I feel like a stranger, doctor." And I immediately understand they are not exaggerating. They truly have lost their sense of wholeness, because when blood flows weakly, the body no longer has the opportunity to maintain the functions that are each individual's unique signature. Vitality, the essence once infused in every step and every breath, vanishes, replaced by chronic fatigue and prolonged loss of confidence. The saddest part is that when blood no longer supplies adequately to the corpora cavernosa in the penis or the spongiosum in the vagina, both desire and physiological capacity not only diminish but are often accompanied by hesitation and self-consciousness, causing many to shy away from intimate moments they still deserve to enjoy. Vessel constriction not only obstructs flow to the heart and brain, but also blocks the path to your partner's heart, widening the emotional distance. When I explain to patients that this condition is not a psychological joke or merely the result of temporary stress, but rather a reversible biological rule, their eyes light up with hope. They realize they still have the chance to flip the switch, letting energetic blood surge back, carrying oxygen, nutrients, and the vibrant sensations they thought they'd lost forever. Restoring NO production and improving vessel wall elasticity is not just a medical issue, but a story of reclaiming control over your body, reigniting the flame of confidence and inner desire. Therefore, when you understand that cold limbs, restless sleep, mental fog, and even emotional distance in your love life are merely signs that your blood flow is weakening, you hold the key to finding yourself again. Next, we will clarify each step to improve this condition, beginning with adjusting body pH, reactivating nitric oxide production, and gradually bringing energy, clarity, and intimate connection back into your life. Following the frustrations of poor circulation leaving you feeling alienated from yourself, let us explore how baking soda, a readily available alkalizing agent in your kitchen, can become a shield that protects and restores vascular flexibility, thus reopening the life-giving flow throughout your entire body. When you drink 1/4 teaspoon of baking soda dissolved in a glass of warm water, the first sensation is not merely a soothing of your stomach, but a small yet powerful chemical reaction. Sodium bicarbonate immediately neutralizes excess H ions, shifting your blood's pH from an acid-leaning state back toward the ideal 7.35 to 7.45 range. That range is not just a dry medical statistic, but the very fuel that enables the enzyme nitric oxide synthase, NOS, to function optimally. Only when pH is stabilized can NOS kick off the conversion of L-arginine into nitric oxide, the essential signaling molecule for smooth muscle relaxation in vessel walls. Once NO is synthesized in sufficient amounts, it targets the endothelium, activates guanylate cyclase, raises cyclic GMP levels, and consequently relaxes vascular smooth muscle, reduces stiffness, lowers intravascular pressure, and allows blood to flow more freely. You can imagine that from brain to heart, from liver to limbs, every blood vessel is opened to a stream rich in oxygen and nutrients, clearing blockages and restoring warmth to areas that once felt ice cold. Baking soda's benefits extend beyond supporting nitric oxide production. It also reduces chronic inflammation, a silent enemy that gradually thickens vessel walls, diminishes elasticity, and creates fertile ground for free radical attack. Prolonged acidity triggers inflammatory cycles, activates pro-inflammatory cytokines, damages the endothelium, and raises atherosclerosis risk. By balancing pH, baking soda inhibits the acidic environment that fuels inflammation, curbs free radical formation, and eases joint and muscle aches, symptoms often accompanying poor circulation that leave you feeling numb and uncomfortable. Imagine each morning when you sip your baking soda drink, you're not only relieving gastric heaviness, but also banishing free radicals, restoring your vessel lining, and rebooting your body's biochemical systems. Your arteries and veins become more supple, and each heartbeat, the source of all movement, grows stronger and steadier. Flexible vessels not only reduce fatigue in daily activities, but are crucial for preserving agility and quick reflexes, from swinging your legs out of bed to the delicate motions of intimacy. As a result, you won't just feel invigorated and full of life, but also mentally sharper, clearer in your decisions, and more connected in personal relationships. I have seen many patients over 65 who, after adopting a scientifically guided baking soda routine, measured dosages at proper times combined with a diet rich in greens and reduced processed foods, report that their bodies restarted like well-maintained machines. They tell me that after just 1 to 2 weeks, their legs no longer felt numb stepping downstairs. Their muscles ceased aching when standing up or sitting down, and their hearts beat more forcefully, signaling a vigorous rhythm. Remarkably, many also share that their mental fog lifted. They concentrate more easily, their memory improves, and they sleep more deeply thanks to restored cerebral circulation. Perhaps the most meaningful change is physiological. As blood flow to the corpora cavernosa improves, libido and erectile capacity return, giving them renewed confidence and self-assurance in their relationship with their partner. No longer embarrassed or hesitant, they embrace intimate moments with hearts brimming with hope and vitality. This is the clearest proof of the power of a small habit. Drinking baking soda, when understood correctly, applied properly, and paired with a healthy lifestyle. With over 25 years of experience alongside elderly patients, I affirm that baking soda is not an infinite panacea, but it is the small key that unlocks vascular flexibility and reignites energy once thought lost. Continue exploring the next steps with me to enrich your personal health map, ensuring that each morning you awaken fully aware of yourself and the joy of close connection with loved ones. Following the process of rebooting your blood vessels with baking soda and improving vessel elasticity, let us explore the practical benefits this method brings to those over 65, from sleep quality to daily energy, and even the sweet bond in marital relationships. First, when blood flows smoothly, your body no longer has to struggle to deliver oxygen and nutrients to your extremities, so the cold numb sensation in hands and feet common among seniors, which wakes you at night just to stretch or massage, gradually resolves. Instead of restless, tossed and turned nights, you will experience deeper sleep, fewer awakenings, and wake up fully refreshed, no longer feeling sluggish or as if you ran a marathon in your dreams. With improved circulation, your brain receives sufficient oxygen, helping regulate your circadian rhythm, and over the long term, your sleep quality will be naturally consolidated and maintained. Next, one of the most marked changes my patients notice is the resurgence of energy. After just 1 to 2 weeks of consistently taking the correct baking soda dose at the proper times, they report that they no longer endure chronic fatigue or that heavy feeling in every step, whether walking around the garden or strolling in the park. Instead, they feel clear-headed and alert all day, easily focusing on small household tasks and even feeling motivated to join light recreational activities with friends and family. When your muscles are supplied with oxygen steadily, cellular energy metabolism is activated more efficiently, helping you recover quickly from minor movements or even simply standing up and sitting down. Finally, for those concerned with emotional closeness, removing the barrier of poor circulation is the key to rekindling natural desire and warm intimacy with your partner. The blood vessels around the reproductive organs, highly sensitive to changes in nitric oxide and intravascular pressure, when reopened, thanks to balanced pH, will receive sufficient blood flow to the corpora cavernosa and spongiosum, making you feel desire awaken, increased sensitivity, and easier maintenance of an erection. Many of my patients have shared that they notice a distinct difference. Instead of embarrassment and shyness, they feel full of confidence and excitement for intimate moments, as if reliving the passionate days of youth. That bond then extends beyond the physical to the emotional, from affectionate glances to joyful smiles when two people come together again. Thus, baking soda not only improves a single aspect of health, but delivers comprehensive effects. You sleep better, have more abundant energy, and, most importantly, rediscover genuine connection with loved ones. These seemingly small changes, when combined, create a turning point that helps those over 65 not merely exist, but truly live fully each day, motivating you to maintain healthy habits long-term and enjoy life more completely. To maximize the benefits of baking soda safely and effectively, you need to adhere to the following detailed guidelines. Based on my clinical experience, Dr. Harris, after over 25 years of working with elderly patients. First, the standard dosage is 1/4 teaspoon, about 1.2 grams, of pure baking soda, free of impurities, fully dissolved in 240 milliliters of room temperature water. Correct dosing not only ensures blood pH returns to the balanced 7.35 to 7.45 range, but also avoids sodium overload, which can lead to edema, increased blood pressure, or electrolyte imbalance if bicarbonate levels exceed safe thresholds. An important note is to stir gently until the baking soda is completely dissolved, no sediment, and drink immediately after mixing, not more than 10 minutes later, to ensure the bicarbonate is absorbed as quickly as possible and minimize esophageal irritation from undissolved particles. Timing is also crucial for baking soda to exert its optimal effect. According to the body's biological cycle, acid accumulation in the blood peaks in the early morning after a long night without supplemental food or drink. At that time, blood pH easily tilts toward acidity, inhibiting nitric oxide synthase and impeding vessel dilation. Therefore, drink your baking soda water before breakfast, at least 30 to 45 minutes before your first meal of the day and before enjoying your morning coffee, so your body has time to rebalance pH, stimulate nitric oxide production, and pave the way for vigorous blood flow to every organ, including the brain, muscles, and reproductive tissues. As for frequency, I recommend adopting this habit 3 to 4 times per week, not daily. The reason is that the body needs time to adjust and reestablish its intrinsic acid-alkaline buffering mechanism. If used too frequently, the water retention and sodium accumulation effects of baking soda may exceed the kidney's excretion capacity, especially in seniors with reduced renal function. Spacing doses, for example, Monday, Wednesday, Friday, and Sunday, give the body enough time to rest and self-regulate, while also allowing you to monitor your body's response, from morning alertness to changes in heart rate, blood pressure, and sleep quality. Some special precautions not to be overlooked: a hypertension, heart failure, or chronic kidney disease. Before starting baking soda therapy, consult your treating physician or a nutrition expert to assess sodium excretion capacity and electrolyte balance, as baking soda can affect both blood pressure and extracellular fluid volume. Never ingest dry powder directly. Doing so can damage the mucous membranes of the throat, esophagus, and stomach, leading to pain or ulceration. Always ensure the baking soda is fully dissolved before consumption. Drink sufficient water. You should supplement with at least 1 to 2 cups of plain water throughout the day to support renal elimination of excess bicarbonate and prevent constipation or cramps from electrolyte imbalance. Quality of baking soda. Not all brands on the market are suitable for ingestion. Choose a product labeled food grade, free of anti-caking agents or heavy metal contaminants. You can find food-grade baking soda at pharmacies or major supermarkets. With this method, your body receives just enough bicarbonate to rebalance pH, reactivate nitric oxide synthase, and promote nitric oxide production, the catalyst for vasodilation. while reducing chronic inflammation. The result is improved circulation, faster delivery of oxygen and nutrients to cells, deeper sleep, mental clarity, abundant energy, and a natural revival of sexual desire. As with any healthcare routine, it is crucial to persistently monitor and adjust based on your body's feedback. Keep a weekly health journal. Measure blood pressure, track heart rate, sleep quality, and comfort in daily activities. If you notice any abnormal signs such as edema, dizziness, or diarrhea, pause immediately and consult a medical professional. Over more than 2 decades of treating thousands of patients over 65, I, Dr. Harris, have witnessed baking soda become the right-hand tool that restores vascular flexibility and enhances quality of life. Begin this simple habit with 1/4 teaspoon dissolved in 240 milliliters of water each morning, 3 to 4 times per week. Track every change and feel free to share your experience in the comments. I promise to read all your feedback and personally address every question so we can maintain a healthy, vibrant lifestyle together. When you begin to see clear positive effects from balancing pH, stimulating nitric oxide production, and improving circulation through the scientific habit of drinking baking soda, it's all too easy to fall into the mindset of the more, the better, or use it every day to finish what's left. However, those seemingly harmless thoughts can lead to unwanted consequences and even harm your health. First, let's talk about excessive dose escalation, the most common mistake. Many people mistakenly believe that if 1/4 teaspoon of baking soda makes them feel alert and clear-headed, then 1/2 or 1 teaspoon will double the effect. In reality, baking soda supplies sodium bicarbonate, and when blood sodium concentration exceeds safe limits, you risk developing hypernatremia. This may present as unrelenting thirst, dry mouth, and even edema from water retention. Over the long term, high sodium pressure in the vessels raises blood pressure, adding strain to a cardiovascular system already weakened by age. You may also feel dizzy and more fatigued, exactly the opposite of your initial goal. Next, the second error to avoid is daily use. As noted in the safety guidelines, the ideal frequency is 3 to 4 times per week, not every day. Our bodies, especially those over 65, need rest periods between baking soda doses to support the endogenous acid-alkaline buffering mechanism. If you overuse it and drink baking soda daily, your body will not have enough time to excrete excess bicarbonate and reset its natural production rhythm. The long-term result can be metabolic alkalosis, which may manifest as muscle cramps, tingling or numbness in the hands and feet, nausea, and even cardiac arrhythmias. Additionally, daily use forces the kidneys to work continuously to maintain electrolyte balance, increasing the risk of kidney function decline, particularly concerning as renal filtration capacity diminishes with age. Finally, equally important is not consulting a professional. It may sound tedious and is often overlooked, but this very complacency can expose you to risks if you have underlying illnesses or are on chronic medications. For example, in hypertensive patients taking diuretics or ACE inhibitors, adding sodium bicarbonate can disturb electrolyte balance, rendering medications less effective or causing serious side effects. Likewise, in heart failure or chronic kidney disease, high sodium levels promote fluid retention, further burdening the heart and kidneys. Even in diabetes, sudden shifts in blood pH can affect glucose and insulin metabolism. Therefore, always discuss with your physician, providing a full medical history and list of current medications before starting any baking soda supplementation regimen. Thus, to maintain a baking soda habit that is safe, effective, and sustainable, you must follow these principles. Do not increase your dose arbitrarily. Maintain proper intervals between doses, and always consult a healthcare professional if you have underlying conditions or are on medication. When you respect these precautions, your body will receive balanced pH support, stable activation of nitric oxide synthase, reduced chronic inflammation, and enhanced circulation, resulting in deep sleep, abundant energy, and a sweet connection in your marital relationship. A small habit can transform your quality of life positively, as long as you apply it correctly and under expert supervision. Finally, you may not see the effects of baking soda overnight, but trust that improving vascular health is the solid foundation that helps you restore abundant energy, sharp clarity, and deep connection with yourself and loved ones so that you can fully enjoy life each day. Baking soda is not a magical wonder that can erase every problem in an instant, but when used correctly, right dose, right frequency, it acts as a subtle key that activates the body's self-regulation mechanisms, bringing pH back to the optimal range, stimulating nitric oxide production and vasodilation, while inhibiting chronic inflammation, factors that determine the most vibrant version of yourself. Remember that age is not the final limit, but merely a reminder that your body may need external support. And among many natural methods, baking soda is a simple, easy, and inexpensive choice that delivers integrated benefits. You will sleep deeply, feel less cold, awaken fewer times at night, be more alert in the morning, and brim with energy for a long day. Enhanced circulation also drives energy regeneration, improves brain function, reduces stress, lifts mood, and especially rekindles desire and warm intimacy in your marriage, all stemming from more effective delivery of oxygen and nutrients throughout your body. With just 1/4 teaspoon of baking soda and 240 milliliters of warm water each morning a few times per week, you have given yourself a powerful tool to balance pH, awaken nitric oxide synthase, and let blood flow smoothly through every vessel, helping you feel every breath, every step, and every intimate moment. In this process, the most important things are patience and listening to your body. Record your sensations each week, from sleep quality, alertness, and physiological sensitivity to overall energy, so that every adjustment is based on genuine feedback from your body. If you have any concerns about dosage, frequency, or interactions with current medications, please do not hesitate to consult your doctor or a healthcare professional for the most accurate advice, because your health always deserves careful attention and thorough care. Personally, I, Dr. Harris, am always ready to accompany you, share knowledge, and listen to every story and question you have. I encourage you to subscribe to the channel and turn on notifications so you won't miss any in-depth instructional videos in the future. Every comment and experience you share is precious, and I promise to personally answer each question and help you tailor this habit to your health status. The journey of rekindling youthful breath does not end with drinking a glass of baking soda a few times a week. It also opens the door to exploring additional supportive measures, such as maintaining a diet rich in greens, limiting processed foods, engaging in gentle exercise, and managing stress effectively. When these factors combine harmoniously, you not only restore vascular function, but also build a healthy, sustainable lifestyle that helps your body withstand every challenge of aging and the environment. And importantly, you will no longer feel alien to yourself, but will proudly march onward, full of vigor, clarity, and deep connection with your loved ones. I send you wishes for health, patience, and unwavering confidence that each morning you can bring the best version of yourself to your family, friends, and community. Let baking soda become the silent but powerful companion on your journey to reclaim vitality and youthful energy, because you deserve every opportunity to live fully, powerfully, and passionately. I am Dr. Harris, and I look forward to continuing this journey with you and hearing your successes on this channel. Wishing you lasting health, clarity, and abundant vitality.